Hello, I'm one of the staff members at IMCES, the Institute for Multicultural Counseling and Education Services. Our community clinic is reaching out to the community to inform everyone about the coronavirus in a simple way. I'm going to show you how the virus affects us and what we can do for protection. The Los Angeles County Department of Public Health is asking you to help slow the spread of the coronavirus, Covid-19. We encourage you to be informed and to review your household plan to help protect your health. Now, understand how coronaviruses are spread. Like other respiratory illnesses, human coronaviruses most commonly spread to others from an infected person through droplets produced through coughing, sneezing, and talking, close personal contact, such as caring for an infected person. COVID-19 may also spread by touching a surface or object that has the virus on it, and then touching the mouth, nose, or eyes. But this is not thought to be the main way the virus spreads. Some people get COVID-19 without ever showing symptoms, but they can still spread the infection to others. All right, let's talk about symptoms. Know the symptoms of COVID-19. Reported illnesses have ranged from people with mild symptoms to people becoming severely ill, requiring admission to the hospital and dying. Symptoms include fever, cough, shortness of breath, difficulty breathing, fatigue, chills, congestion or runny nose, muscle or body aches, headache, sore throat, nausea or vomiting, diarrhea, new loss of taste or smell. All right, practice physical distancing. Public Health is asking everyone to do their part to help slow the spread of novel coronavirus in our community by practicing physical distancing, also known as social distancing. This means avoiding crowds and keeping at least 6 feet away from others whenever possible. How to practice physical distancing. Stay home as much as possible. Avoid any places where a lot of people are together. Maintain a distance of at least 6 feet from others. Work or study from home if possible. Now, call your doctor or dentist before visiting to find out if they offer telemedicine or phone advice. If you or family members are due for routine immunizations, contact your provider to schedule an appointment. Avoid non-essential travel. Avoid public transport if you can. Avoid contact with people. Instead of shaking hands, come up with other ways to greet people that don't involve any touching or getting closer than 6 feet. If you do use public transport, shop, go to work, or participate in other activities, take precautions to reduce the risk, such as limit the amount of time you spend in close contact with others. Limit the number of different people you spend time with. Keep as far away from others as possible, especially if they are coughing or sneezing. Choose outdoor over indoor activities that involve others outside of your household. Participating in indoor activities can increase your risk of exposure to COVID-19, especially in spaces with poor ventilation. Wear a cloth face covering at all times when you are out and around other people. Make sure to use it properly. See Public Health guidance for cloth face coverings for more information. Note: a mask or cloth face cover should not be placed on anyone who has trouble breathing or is unable to remove it without assistance. Infants and children under the age of 2 should not wear cloth face coverings. Those between the ages of 2 and 8 should use them, but under adult supervision to ensure that the child can breathe safely and avoid choking or suffocation. Those instructed not to wear cloth face coverings by a medical provider are also exempt from wearing one. Try to go to places at times when they are less busy. Avoid touching surfaces in public places when possible. Clean and disinfect frequently touched surfaces regularly. Clean your hands often, especially after touching surfaces in public places, and before eating, and avoid touching your face with unwashed hands. Now, I'd like to share some information on private gatherings with one or two other households. Private gatherings with people from different households increases the risk of COVID-19 transmission, with the risk increasing the longer the private gathering and the more people attending. The fewer people you and your household have in-person contact with, the lower your risk of getting COVID-19. You and your household can gather with one or two other households as long as you gather privately outside and for no more than 2 hours. Everyone wears face coverings. Everyone stays at least 6 feet from non-household members. If you do choose to take this risk, keep the group constant with the same 1 to 2 households, rather than participating in multiple private gatherings with different households over time. For additional rules on private gatherings, see the guidance on small private gatherings. All right, let's talk about tips for people with children. Explain to your children that hand washing can keep them healthy and stop the virus from spreading to others. Be a good role model. If you wash your hands often, they're more likely to do the same. For more information, see the CDC's guidance, Hand Washing, a Family Activity. Let's spend some time on how to get food and other necessities. Have one member of the household go to the store. Go when it's less busy and stock up on essential supplies so that you don't have to go out as often. And keep at least 6 feet away from people as much as you can. You can use food delivery, drive-through, or carry out as long as everyone practices physical distancing. Be sure to follow any rules they have put into place for physical distancing and infection control. If you order something for delivery, if possible, pay and tip electronically, and ask for the item to be left outside your door. Remove food from delivery bags and boxes and dispose of the packaging. Wash your hands after handling the packaging. If you are at higher risk of getting sick from COVID-19, ask for food, medical supplies, and other essentials to be brought to your door through family, neighbors, or delivery services. Call 211 or visit the Public Health Resources webpage, ph.lacounty.gov/media/coronavirus/resources.htm if you need assistance getting food and other essential items. All right, here are some additional tips for people with children. The Los Angeles Unified District, in conjunction with the Red Cross, provides meals to students through their grab-and-go food centers on weekdays from 8 a.m. to 11 a.m. Find a location near you at LAUSD's Resources for Families During School Closure page. There are also meal distribution sites offered by other school districts throughout Los Angeles County. Search the student meal distribution sites here for the address and hours of operation for a site near you. Tips for coping with physical distancing. Talk to your employer about options for working from home. Exercise at home or outdoors. Avoid isolation by using technology and the phone to communicate with friends and family often. Take care of one another. Check in by phone with friends, family, and neighbors who are vulnerable to serious illness or have mobility issues. Offer to help while still following physical distancing guidelines. Stay informed through trusted sources for the latest accurate information about novel coronavirus. I'd like to give you some additional tips for people with children. Help your children stay physically active. Encourage them to play outside while practicing physical distancing. Take a walk with them or go on a bike ride. Try indoor activity breaks to stretch or move throughout the day to help your children stay healthy and focused and take advantage of outdoor recreational activities that are now open. Help your children stay socially connected. Reach out to friends and family via phone or video chat. Write cards or letters to family members they may not be able to visit. All right, let's talk about playdates. If you decide to have playdates with other families, limit their encounters to the same 2 or fewer households each time, and follow the guidance in the Private Small Gatherings document. School at home. Review assignments from school and help your children establish a reasonable pace for completing the work. If you face technology or connectivity issues, or if your child is having a hard time completing assignments, let the school know. Have consistent bedtimes and get up at the same time, Monday through Friday. Structure the day for learning, free time, healthy meals and snacks, and physical activity. Allow flexibility in the schedule. It's okay to adapt based on your day. Look for ways to make learning fun, using hands-on activities like puzzles and drawing. Start a journal with your child to document this time and discuss the shared experience. Also, check out the LA County Library resources to gain access to the library at home, or use curbside pickup services where available. There are digital books, audiobooks, and hosted online activities. Talk to your child about expectations and how they are adjusting to being at home versus at school. All right, I'd like to spend some time with you talking about how to take care of your emotional health. Take care of the emotional health of yourself and other household members. Outbreaks are stressful for everyone, but children may respond differently from adults. Watch for signs of stress in your child. Excessive worry or sadness, unhealthy eating or sleeping habits, and difficulty with attention and concentration. For more information, see the For Parents section of CDC's Stress and Coping. Take time to talk to your child about the COVID-19 outbreak, answer questions, and share facts from CDC's Stop the Spread of Rumors guide about COVID-19 in a way that your child can understand. Go to CDC's resources helping children cope with emergencies or talking with children about COVID-19. If you are feeling anxious or overwhelmed, the Los Angeles County Department of Mental Health, LAC-DMH's COVID-19 webpage, and the 211 LA webpage, 211la.org/resources/subcategory/mental-health. Provide local resources to address mental health and well-being needs and concerns. If you want to speak with someone about your mental health, contact your doctor or the Los Angeles County Department of Mental Health Access Center 24/7 helpline at 1-800-854-7771. Teach your family the importance of taking steps to prevent infection at home. Wash hands often and do it thoroughly. Use soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol for at least 20 seconds. Do not share objects such as utensils, cups, food, and drink. Clean and disinfect surfaces that you touch frequently. Routinely clean and disinfect all frequently touched surfaces and objects, such as doorknobs, banisters, countertops, toys, remote controls, faucet handles, and phones. Use the usual cleaning agents and follow the labeled directions. Clean surfaces and items to remove visible dirt and disinfect them to kill germs. Follow the instructions on the product labels, including wearing gloves and having good ventilation. Use household cleaners and Environmental Protection Agency (EPA) registered disinfectants that are appropriate for the surface. To find out if the product works against viruses, read the product label, call the 1-800 number on the label, or visit www.epa.gov. A bleach solution can also be used as a disinfectant. Mix 4 teaspoons of bleach to 1 quart or 4 cups of water, or for a larger supply, add 1/3 cup of bleach to 1 gallon, 16 cups of water. For more information, see the Public Health Guide, Preventing the Spread of Respiratory Illnesses in the Home. Know what to do if you become ill. Look out for symptoms of COVID-19 listed above. If you develop symptoms, call your doctor and follow the instructions in the Public Health Home Care Instructions for People with Respiratory Symptoms, which can be accessed at the website listed here. Prepare your household or review your household plan if you already have one. Make sure that you know phone numbers for your doctor's office, local urgent care, and ER facilities so that you can call them if you become sick instead of just showing up. Put important numbers on the fridge and in your phones. If you don't already have a healthcare provider, the County Information Line 211 can help you to find one. Make a plan for taking care of family members who are elderly, disabled, or sick if they or their caregivers become ill. Identify another household member, if possible, to be in charge of preparing meals and cleaning up. Create an emergency contact list. Ensure your household has a current list of emergency contacts for family, friends, neighbors, carpool drivers, teachers, employers, and other community resources. Know that you can call the LA County Information Helpline 211. Get to know your neighbors. Talk with your neighbors about emergency planning. If your neighborhood has a website or social media page, consider joining it to maintain access to neighbors, information, and resources. Identify aid organizations in your community. Create a list of local organizations that you and your household can contact in the event you need access to information, healthcare services, support, and resources. Consider including organizations that provide mental health or counseling service, food, and other supplies. Know that you can call the LA County Information Helpline 211. Have adequate supplies of prescription medications, as well as over-the-counter medicines to help with cold and flu symptoms. For information, visit the CDC webpage, www.cdc.gov/COVID-19-NCOV/get-your-household-ready-for-COVID-19-HTML. Report stigma. The county is committed to assuring that all residents affected by COVID-19 are treated with respect and compassion. We must separate facts from fear and guard against stigma. The outbreak is no excuse for spreading racism and discrimination. If you or someone you know experiences discrimination based on race, nation of origin, or other identities, please report it. You can report hate crimes, hate acts, and incidents of bullying in Los Angeles County, whether or not a crime has been committed. Call the Los Angeles County Information Line 211, which is available 24/7, or file a report online at the web address listed here. Know where to get reliable information. Beware of scams, false news, and hoaxes surrounding COVID-19. Visit Public Health's COVID-19 Scams webpage at ph.lacounty.gov/HCCP/COVID scams. For more information and resources on how to avoid COVID-19 healthcare scams. IMCES is a nonprofit community clinic committed to providing direct mental health services to ethnically diverse, underserved communities in Los Angeles. Our mission is promoting human rights, equity, and social justice by reducing disparity and providing access to resources, leveling the ground for all to walk on. We believe that equal access to health and mental health services is the human right of all. For more information, please visit our website, www.imces.org, or call us at 213-381-1250. Please be safely well. Accurate information, including announcements of new cases in LA County, will always be distributed by Public Health through press releases, social media, and our website. The website has more information on COVID-19, including frequently asked questions, infographics, and a guide to coping with stress, as well as tips on hand washing. Los Angeles County Department of Public Health, LACDPH County. www.publichealth.lacounty.gov/media/coronavirus. Social media at LA Public Health. Other reliable sources of information about novel coronavirus are California Department of Public Health, CDPH State, www.cdph.ca.gov/programs/CID//Covid19.aspx. Centers for Disease Control and Prevention, CDC National, www.cdc.gov/coronavirus-novel-coronavirus-2019.html. World Health Organization, WHO International, www.who.int/health-topics/coronavirus. 9/11 is not for health information.